Easdent Complete Denture Workflow. Recording preset VDO. For most Class 1 patient, the distance from the outer canthus of the eye to the commissure of the lips equals the distance from the lower border of the septum of the nose to the lower border of the chin when the patient's jaws are in centric relation and VDO. Preset the VDO using a tongue blade or Easdent measure for later use. For tongue blade, mark line 1 to match the lateral commissure of the eye and line 2 to match the commissure of the mouth. The distance between line 1 and line 2 is the desired VDO. The older patient's corner of the mouth may sag down. You can reduce 2 mm to mark line 2. Class 2 patients' mandibles are smaller. You can also reduce a couple of millimeters. Class 3 patients' jaws are bigger. You can add several millimeters. Mark a third line 2 millimeters above line 2. The distance between line 1 and line 3 is the preset starting VDO. The preset starting VDO is 2 millimeters shorter than the desired VDO. It gives extra space for impression thickness. When you finish mandibular final impression, the VDO may reach the desired VDO. For Easdent measure, use the outer edge of the shorter stick to match the lateral commissure of the eye and the outer edge of the movable handle to match the commissure of the mouth. The outer edge of the shorter stick equals line 1 on the tongue blade, and the outer edge of the movable handles equals to line 2. The distance between these two lines is the desired VDO. Both sticks are 2 millimeters wide. The inner edge of the movable handle equals line 3. The distance between the outer edge of the shorter stick to the inner edge of the movable handle is the preset starting VDO. Pick and adjust Easdent trays. Pick a set of Easdent trays that best match the arches. You can adjust Easdent trays to better fit the patient's arches. If the Easdent trays are too wide or too narrow for the arches, you can put both Easdent trays with elastomers in hot water, 65 degrees Celsius or 149 degrees Fahrenheit, and make the Easdent trays wider or narrower. If the trays are too short for the arches, you can add extra moldable material in the back. The trays can also be cut shorter to match the arches. Try the maxillary tray in the mouth to make sure the teeth can be moved to the correct position without pushing hard on the tissue. Use the Fox plane or Easdent measure to verify the occlusal plane, midline, and incisal edge at smile. Let the patient relax. Make sure the incisal edge of maxillary Easdent teeth is not lower than the lip. Moldable material can fill the space and push the Easdent teeth down to an ideal position. Ask the patient if anywhere is hurting. If the supporting frame pushes hard on the tissue or prevents the tray from moving to the correct position, you can warm the supporting area and bend the area with your fingers. When you warm the supporting frame, do not warm the teeth area, as it may change the occlusion with the teeth on the mandibular Easdent tray. You can also load fast-set bite registration material at the area and put the tray in the mouth. You can quickly identify the exact location that prevents seating. You can use the same method to identify the area for the tueri. Use the acrylic burr or disc to cut away the areas that show through. Recording the desired maxillary teeth position using Easdent tray and moldable material. You can use putty PVS impression material as moldable material with Easdent tray to record maxillary teeth position. Use catalyst to base equals 1 to 12 to slow down the setting of the material. Put the material at the tissue side of the tray. Do not put too much material. The amount should correspond to the space between the tray and the tissue when the tray is positioned at the ideal tooth position. When you seat the tray, some material might be pushed to the border. Align the midline of the maxillary anterior teeth on Easdent tray to the midline of the face. Use the Fox plane or Easdent measure to push the Easdent tray in the mouth to align the incisor edge in the vertical direction to give a good aesthetic result with a smile at lip line or tiny bit hidden in the lip line at the rest, and the occlusal plane parallel with the interpupillary line. Extra impression material with border molding and final impression will push the occlusal plane down a little bit later. Align the incisors at the correct sagittal position to provide appropriate lip support, buccal lingually at rest, and good aesthetic result with smile. Make occlusal plane parallel to ala tragus line. If you have extra material at the border, pull the lip down with your fingers to push the extra material out and remove it. Too thick putty material will be difficult to be molded by the lip. It is okay to be a little short at the border now by pulling the patient's lip with your finger. Border molding later will catch the functional border. Mold the rest of the material with various lip movements. Putty impression material will self-set completely in about 5 minutes. In case the putty material is set before you are happy with the teeth position, quickly peel off the material before it sets further and repeat the procedure again. Now you have a customized maxillary Easdent tray with the correct teeth position. Border molding for the customized maxillary Easdent tray. Check the borders to see if the border is too thick or you have overextension. Also check if the tray is showing through the putty impression material. When the border is too thick or the tray showing through the impression material, you have border overextension. Trim the areas thin and remove some extra material with a knife, a disc, or an acrylic burr. Load heavy body PVS material at the periphery of the tray. It is easier to do one side at a time. Push the lip away using the side of the tray without impression material. Swing the tray into the mouth. Press hard to make sure the tray is seated completely and the Easdent teeth remain in the correct position. If you see any border is short, add more heavy body PVS material immediately. Press the heavy body PVS material against into the buccal vestibule area. If the material sticks on your finger, you can wet your finger first or use the cheek to push the material up. Mold the border with various lip movements. It is easy to miss the hamular notch areas and the distal buccal vestibular areas for maxillary arches. After the material is set, evaluate the border again. If the previous material is visible through the new PVS material with irregular shape, it may be overextended. Grind away the irregular see-through areas. If the border is too thick, use a disc or knife to trim it down to a thickness closer to the thickness of the denture border. This will make the tray with the final impression more representative of the denture's shape. Now you have an Easdent custom tray with the teeth position and the nice border. Maxillary final impression. Put a thin layer of regular set light body PVS impression material on the tissue side of the tray. Use a mixing spatula to apply the material to cover the tray evenly. Make sure the border is also covered. Do not put too much material. It may gag the patient. It may also be difficult to seat the tray back to the correct position, which can cause Easdent teeth to be moved to a wrong position. Seat the tray in the mouth. Make sure it seats all the way down. The teeth should be at the same position as previously set. They might be pushed down a little bit due to the material thickness. Verify the horizontal plane, midline, and buccolingual position of the Easdent teeth. You are able to do minor modification of the teeth position at this step by pushing the tray to your favorable position in case your previously set teeth position is not perfect and you want to change a little bit. Mold the border again with various lip movements. Clean away extra impression material on the teeth before it is set. After the material is set, evaluate the final impression. If necessary, you can repair the impression with light body PVS impression material or sticky wax. Make sure no impression material is left on the occlusal surface to interfere with the occlusal contact with the opposing arch. Cut away extra impression material on the buccal, lingual flanges, and palatal area. when you do your final evaluation of the aesthetic and the function of the Easdent impression, the closer the shape of the impression to the shape of the dentures, the better chance the Easdent final impression can function as a try-in. Adjusting mandibular Easdent tray. Check if maxillary Easdent teeth can still occlude nicely with mandibular Easdent teeth in your hand first. If the occlusion of the maxillary teeth has changed a little bit and the maxillary and mandibular teeth cannot get perfect occlusion, warm the mandibular Easdent tray in the hot water, then push the mandibular tray against the maxillary Easdent impression to let the teeth occlude nicely together. To make it harden faster, you can let cold water cool it down. Now you have maxillary and mandibular Easdent teeth that occlude nicely. If the patient's mouth can open wide to fit both maxillary and mandibular trays in at the same time, put elastomers on the buccal hooks to hold the maxillary Easdent impression with the mandibular Easdent tray together and put them in the mouth together. If the patient's mouth cannot open large enough, put maxillary Easdent impression in first, then mandibular Easdent tray, align the teeth. Hold the mandibular tray there, let the patient bite down in centric relation until the mandibular tray touches the tissue at the first spot. Use tongue blade or Easdent measure to check the preset starting VDO. If the distance between the lower border of the septum of the nose and the lower border of the chin is bigger than the preset starting VDO, or the tray is pinching at the tissue somewhere when the distance is at the preset starting VDO, you need to adjust the trays first. First, check which arch to adjust. If your maxillary impression was too thick, maxillary Easdent teeth may be pushed to a wrong position, the incisal edge may be too low, or the horizontal plane may be tilted. It could also be that the aesthetic of the anterior maxillary Easdent teeth is good, but the posterior teeth are too low. You can trim the maxillary teeth short by using a disc on the straight handpiece. You can also disinfect the maxillary Easdent impression and use the model trimmer to trim away from the occlusal surface. Try to not do the trimming of the anterior teeth too much because it may affect the aesthetic evaluation later. That is why I left a little extra impression material room when I use the putty PVS impression material to set up maxillary Easdent teeth. The second molar areas of maxillary Easdent impression may affect catching a good impression of the retromolar pad areas. You can cut the second molar area away. If maxillary Easdent teeth are in a good position, you just need to adjust the mandibular tray. When both the maxillary Easdent impression and the mandibular Easdent tray are in the mouth and their teeth are articulated correctly, and the patient is biting down at centric relation to the preset starting VDO, ask the patient if anywhere is hurting or if anything is pushing too hard in the mouth. You can quickly identify the location of the high pressure area by loading super fast bite registration material in the area and seat the trays back in the mouth and let the patient bite again. You can either grind away the show-through area or heat the area in the hot water and bend the area with your finger, or let the patient bite down more to mold the supporting frame when the area is still warm. If the buccal or lingual supporting frame is too far away from the ridge, you can also warm the area in the hot water and bend the supporting frame to adapt to the ridge better. Do not put the teeth in the hot water. It may change the occlusion with the maxillary Easdent teeth. Keep adjusting until the distance between the lower border of the septum of the nose and the lower border of the chin is equal or less than the preset starting VDO. Recording mandibular teeth position, VDO, and the centric relation. If the patient can open wide enough to allow both maxillary impression and mandibular tray to be inserted together, secure the maxillary Easdent impression to the mandibular Easdent tray using elastomers. Mix putty PVS impression material with a catalyst to base ratio of 1:12 and apply it to the tissue side of the mandibular Easdent tray. Put less moldable material, leaving the buccal and lingual support area not covered, especially the lingual area. It is a little difficult to do the border molding at this stage, You want to focus on the teeth position and occlusal relationship, not want to have overextension of the border. Seat the maxillary Easdent impression together with the mandibular tray completely in the mouth. A good maxillary impression should have slight suction and remain stable in the mouth without support. If the maxillary impression is unstable due to severe ridge resorption, apply a small amount of denture adhesive to the tissue surface of the maxillary Easdent impression before seating it. This will stabilize the impression in the mouth and eliminate the need to hold it in place by hand. If the patient cannot open wide enough to fit both trays in simultaneously, leave the elastomers on the hooks of maxillary Easdent impression and seat the maxillary impression in the mouth. Then add the moldable material to the tissue side of the mandibular tray and insert the tray into the mouth. Hook the 4 elastomers from the maxillary Easdent impression onto the hooks of the mandibular Easdent tray. This will free your hands to record centric relation and VDO. Guide the patient to bite at the centric relation slowly into the preset starting VDO using a tongue blade or Easdent measure as a guide. If the hooks on the maxillary Easdent impression were trimmed away when you were adjusting the maxillary Easdent impression, or it is too difficult for you to put the elastomers from the maxillary hooks to the mandibular hooks, you can also just use one hand to hold the mandibular tray and guide the patient to bite into centric relation using the other hand, and then grab the tongue blade or Easdent measure. Let the patient continue biting until the distance between the lower border of the septum of the nose and the lower border of the chin is equal to the preset starting VDO. Once the jaw is at the correct position, make sure the patient stays in this jaw relationship. If you put extra material, use your finger to pull the lips to mold the extra material out and remove the extra material. Remove the 4 elastomers and separate the maxillary impression with the mandibular tray quickly. Hold the mandibular tray in position. Let the patient move the tongue around to mold the lingual border. By the time the elastomer is removed, the putty PVS material might be partially set. It might be difficult to mold the border very well, and it might be easier to get an overextension. That's why you should not put too much moldable material in the lingual. Putty impression material will self-set completely in about 5 minutes. Now you have a customized mandibular Easdent tray that records teeth position and jaw relationship. Border molding for customized mandibular Easdent tray. Check the borders to see if the border is too thick, which means you have overextension, just like the maxillary Easdent tray. Trim away the extra material before you start border molding. Short areas can be filled by border molding. Use heavy body PVS material to do the border molding. Load the material at the border. Do one side at a time. Seat the tray completely in the mouth. Press the tray hard to make sure the tray is seated correctly. Guide the patient to bite in centric relation until maxillary and mandibular Easdent teeth in contact to verify the seating. Check the border. If anywhere is still short, load additional material. It is easy to miss retromolar pads and distal lingual vestibular areas for mandibular arches. You can load extra material there. After loading extra material, press the material against the buccal and lingual vestibule area and retromolar pad area. Then mold the border with different lip or tongue movements and remove the extra material. If you miss the retromolar pad areas due to maxillary posterior teeth biting into the areas, cut maxillary second molar areas short to give room. Then add heavy body PVS material at the missing retromolar pad area and reseat the tray back to the mouth. After you press the heavy body PVS material in the retromolar pad areas, let the patient bite down and then open to mold the material with functional movement, then bite down and open again. Do not let the patient stay biting down all the time. The newly added heavy body PVS impression material may stick to the maxillary impression material and set together. After the material is set, evaluate the border. If the previous material is visible through the new PVS material with irregular shape, it may be overextended. Grind away the irregular see-through areas. You can redo border molding if the cut away area is big. Use a disc or knife to trim away the extra material. Now you have a mandibular Easdent custom tray with the teeth position and the nice border. Mandibular final impression. Put a thin layer of regular set light body PVS impression material on the tissue side of the tray. Use a mixing spatula to apply the material to cover the tray evenly. Make sure the border is also covered. Do not put too much material. It may be difficult to seat the tray back to the correct position, which can cause Easdent teeth to be moved to a wrong position. The VDO may also be increased. Seat the tray in the mouth. Make sure it sits all the way down. Let the patient bite down in centric relation until both maxillary and the mandibular Easdent teeth touch to verify the correct seating. Movement of the tray can happen, especially for the patient with a resorbed ridge. You can move the mandibular Easdent custom tray a little bit at this time if you want to correct the teeth position. Mold the border with various lip and tongue movements. Clean away extra impression material before the material is set. If necessary, you can repair the impression with a little more light body PVS impression material or sticky wax, the same as what I showed you for repairing maxillary impression. After the material is set, make sure no impression material is left on the occlusal surface to interfere with the occlusal contact with the maxillary arch. Cut away extra impression material on the buccal lingual flanges. Aesthetic evaluation. The Easdent final impressions with teeth in place closely resemble the shape of dentures. They can be used as try-in dentures to evaluate aesthetics, give the patient a mirror, and get the patient involved in the aesthetic evaluation with you. Seat them in the mouth completely. Good impression should have a little suction and stay in the mouth. However, if the ridge is resorbed badly, the impressions may not stay in the mouth. You may need to use some denture adhesive to hold them in the mouth. You have to let the patient know the final dentures will either need adhesive or implant ahead of time. Ask the patients if they are happy with the look. Let the patient relax and smile. Check if the teeth are in the correct position. Is the midline accurate, or does it need to be shifted to the right or left by a few millimeters? You can mark the correct midline on the Easdent teeth or tell the lab to move the midline according to the current midline position if the current midline is not correct. A frontal view smile picture with the teeth visible can help record the issue. Check if the incisal edge is in the correct position. From the frontal view and the profile view, assess whether the height of the incisal edge and the buccolingual position of the incisors are accurate using both the patient's relaxed and smiling positions. Ensure there is adequate lip support. Clinical pictures from frontal and profile views in both relaxed and smiling positions can help determine if the incisal edge is well positioned. Check F or V sounds. The maxillary incisor edge should gently touch the wet-dry line of the lower lip. 55. Recheck the occlusal plane using the Fox plane or Easdent measure to determine if it is correct. If the occlusal plane is tilted, you can trim it with a disc or model trimmer. You can also take front and profile smiling pictures with the Fox plane or Easdent measure in the mouth to document the tilt and let the lab adjust the occlusal plane during the denture teeth setup. Ensure the incisal edge is visible in the frontal picture. At rest, the incisal edges of the mandibular incisors should be positioned at the level of the lower lip line or slightly above, symmetrically aligned with the lower lip and following its natural curvature. The midlines of the upper and lower teeth should align with the center of the face. The mandibular occlusal plane should correspond to the corners of the mouth. If the mandibular teeth are not in ideal position, As long as you can provide correct centric relation and VDO and the good clinical pictures, lab can set up the mandibular teeth correctly according to the ridge, retromolar pads, and maxillary teeth position. Pick the shade for the denture teeth and denture base. Most patients are happy with the appearance of Easdent teeth once they see them, so you can simply have the lab mimic the Easdent teeth. You can request the size of teeth bigger or smaller compared to the Easdent teeth. VDO evaluation. The distance from the outer corner of the eye to the corner of the mouth should approximately equal the distance from the base of the nasal septum to the lower border of the chin when the patient is biting at centric relation and VDO. This provides a good starting point for establishing the correct VDO. The VDO should then be verified using the VDR, phonetic and swallowing tests, especially in Class 2 and Class 3 patients. Ask the patient if they feel comfortable with the bite. Listen to their speech to ensure they can pronounce S and M sounds correctly.
Mississippi.
When pronouncing the S sound, the teeth should come close together but not touch, usually remaining about 1 to 2 millimeters apart. During the M sound, the lips should gently touch and the teeth should be slightly apart, a position close to the VDR. Observe the patient swallowing to check for any difficulty. During swallowing, the mandible naturally returns to a position where the teeth make contact. If the current VDO is too large, you can trim the Easdent teeth shorter with a disc or model trimmer, then test the pronunciation, swallow, and VDR again. If you need to open the VDO a little bit, you can do so at the bite registration scanning time. You can also let the lab open or close 1 to 2 millimeter of VDO in your prescription. Clinical pictures. Position the camera about 4 feet from the patient and zoom in to minimize distortion in the images. Take pictures of the patient's face from different angles, profile view, relaxed and smiling, and front view, relaxed and smiling. Ensure the incisal edge and both ears are visible in the frontal smile picture. These pictures are a valuable tool for re-evaluating the aesthetics once the patient has left. They can help determine if the incisal edge is well positioned. If you decide to modify the tooth position, you can indicate the desired midline and horizontal plane directly on the frontal smile pictures or in your prescription. It will provide the lab technician with a clear visual reference to set the anterior teeth according to your request. Scan maxillary and the mandibular Easdent impressions 360 degree. When scanning an Easdent impression, select reference denture or duplicate or copy denture as the scan type. If you use denture adhesive, remove it completely before scanning. If your scanner has AI mode, turn it off. I am demonstrating a scanning strategy. It may differ from your scanner's recommendation, but it has worked the best for me, especially with older scanners that do not capture impressions or dentures reliably. This approach reduces the chance of scan images failing to stitch together correctly, particularly along the borders. Hold the maxillary and mandibular Easdent impressions in your hand and scan each impression. Move the scanner slowly and steadily. Start from the occlusal surface and slowly roll to the border and tissue surface and move to the occlusal surface again and then to the border and tissue surface. Repeat this until all the borders are covered and then finish scanning the tissue surface. Following this scanning sequence, reduce the chance of images not stitching together correctly. The border and tissue surface are the most important. Focus on getting a clear scan there. If there are undercuts that make certain areas difficult to scan, spray a little bit intraoral scanning spray. A light coating will make it much easier to capture the scan. Gently touch the impression and rock the scanner to catch this surface. If severe undercut really makes it hard time to scan the area, you have to add an intraoral scan of the arch. The hole for the undercut area can be filled by merging the impression scan with the intraoral scan. Sometimes, after finishing scanning other areas and returning to the border, you may notice missing data due to software misalignment during stitching. If this occurs, rescan back and forth until all the scans are stitched together correctly. It is important to capture accurate borders from the Easdent impressions, as the intraoral scan cannot capture the border precisely due to the movement of soft tissue at the borders. Therefore, the border of the digital model must come from the Easdent impression. When you finish scanning, turn color off to evaluate. Make sure all the intaglio and border areas have good scan. The occlusal and buccal areas of the Easdent impression help with tooth positioning and bite relationships. Small holes are not critical there. The lingual or palatal surface are the least important. Small to medium-sized holes in those areas are acceptable. Bite relationship scan. Seed Easdent impressions in the mouth. Evaluate whether the Easdent teeth are in maximum intercuspation when the maxillary and mandibular jaw are in centric relation. Ideally, at step 7, recording mandibular teeth position, VDO, and centric relation. When you hold the teeth in maximum intercuspation and guide the patient to bite into centric relation at the pre-measured VDO, after the moldable material is set, centric relation should coincide with maximum intercuspation. If the two coincide, you can have the patient bite down and scan the bite relationship in the mouth. However, errors may occur during the procedure. If there is a discrepancy between maximum intercuspation and the centric relation, you need to use bite registration material to record the centric relation. Load bite registration material on the occlusal surface of the mandibular Easdent teeth. If you have good VDO, guide the patient's jaw into centric relation. Let the patient bite down until the first area just touches. If you need to open the bite, you can use the leaf gauge in between the arches to achieve a specific amount of VDO opening. You can also load bite registration material on the occlusal surface and guide the patient to bite down in centric relation to the desired VDO as guided by the tongue blade or Easdent measure. Be careful not to load too much material and cover the buccal side of the teeth, or you may not be able to get a good scan of the bite relationship. Scan the bite relationship in the mouth. Try to scan more areas even if both arch scans have already moved to the bite scan. The bite built by the software with less scanning may not be as accurate. Prescription writing and case submission. Most scanners allow you to set up the lab you want to submit to directly in the scanner software. You simply select the lab and submit the case. If you need to submit the case manually, make sure to use PLY or OBJ format, as these formats retain color information. Lab technicians can use the color information to identify and adjust potential sore spots. I have trained the lab I work with to adjust sore spots for me, which helps reduce my chairside time. A sample prescription is provided for your convenience. I like 3D milled dentures. They are stronger than 3D printed dentures. With some intraoral scanners, you can upload clinical photos and submit them together with the intraoral scans. With other scanners, you may need to send the clinical photos separately. Providing clinical photos is important because they give the lab additional information to properly evaluate and design the case.